Get answers to your questions about back pain. Call the physicians on our phone bank now at 478-752-1300. Tonight's phone bank sponsored by Neuroservices Navicent Health.
Hi, and welcome back to our live broadcast about back disease. Here with me today is Dr. Arthur Grigorian, and Dr. Arthur Grigorian is a neurosurgeon here at Navicent Health, and we wanted to thank you for coming today. And let me ask you this. We're talking a little bit obviously about back pain, but tell me about when you see a patient, how do you diagnose a patient with back pain?
So I think certainly we need to separate two completely different issues. One is, and all of us here work in Navicent Health. In Navicent Health, it's a level 1 trauma center. So obviously we see a lot of people arriving with the traumas, and when you evaluate a patient with a traumatic injury to whatever part of the body, then obviously the emergency, obtaining imaging studies as soon as possible to decide quickly what is the most appropriate, that takes a priority. That is completely different when imaging takes the main part of diagnosis, because everything needs to be done very quickly. Now, the different scenario is when the patient comes to the office with the complaints. You know, the medicine developed so much, particularly imaging technology, for the last 150 years, that a lot of people think that imaging almost replaced the physician. That is not true. I truly believe that direct interview, direct communication between the physician and the patient, it's still the most important part of the decision-making process. Because what we face when we meet the patients, it's to make the decision. How acute are the symptoms? How bad are the symptoms? What do we need to do? Can we wait longer? There's all sorts of problems and questions that comes to our mind that we need to come up with some kind of plan, a decision. The most important is differential diagnosis. What could be the reason for those symptoms? Can we treat that patient conservatively? Can we wait? Obviously, my approach is probably very conservative. If there is something to wait, I would rather give patients some period of time. Otherwise, we proceed with diagnostic studies.
So there's a lot to consider when a patient comes to see you and get a diagnosis. So we appreciate you spending some time with us.
Absolutely.
And Dr. Grigorian is going to be here on our phone bank to answer your questions. Give us a call at 752-1300.
Tonight's phone bank sponsored by Neuroservices Navicent Health.